How can you tell whether your pain is from rheumatoid arthritis or aging? Hello, this is Dr. Siddharth Dambar, physician here at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine, where we are focused on treating your arthritis and pain with the best available non-surgical treatments possible to get you to feel better and live to your maximum possibility in life. A question that I get on occasion is, how do we know whether somebody's pain is coming from inflammation like rheumatoid arthritis or whether it's coming from normal aging? And what does that mean? So to begin with, conditions like rheumatoid arthritis are autoimmune conditions. And what that means is that your immune system that is meant to help protect you from external bacteria and viruses is miscommunicating and attacking your own body. And in the case of rheumatoid arthritis, attacking your own joints. In other autoimmune conditions, it can be other organs as well. There's a classic presentation for autoimmune conditions, and that includes swelling in the joints. In the case of rheumatoid arthritis, it's a lot of small joints like the hands, the wrists, the feet. It can be other joints as well. Ongoing for over 6 weeks. Pains that are classically worse first thing in the morning and better with activity, and very prominent stiffness first thing in the morning, lasting for more than an hour. On the other hand, when we talk about pain that's coming from aging, there's a number of different things that we can be talking about. There's degenerative conditions like osteoarthritis or tendinitis. Those conditions in turn can then lead to other types of pain like pinched nerves. There's, as we get older, once we hit our 40s and 50s, we all go through various hormonal changes, which in turn on its own can lead to various degrees of pain or weakness or fatigue. That's another form of pain that's coming from aging. In addition, as we get older, we're also at more risk for cardiovascular issues. There's a condition called peripheral vascular disease, where there's tightening or stenosis of the arteries in the arms and the legs that can also lead to pain in the limbs. There's neuropathy or pinched nerves or other neuropathic conditions that we tend to be more prone to as we get older as well. And then there's metabolic health issues. As we get older, we tend to be more prone to diabetes as well. As our metabolic health gets worse, a lot of the issues of aging seem to happen more rapidly, whether that is more degenerative conditions like wear and tear arthritis, or whether that are cardiovascular issues or neuropathy issues. Our metabolic health seems to be a very critical part about this. So how do we tell the difference? Well, from your own standpoint, you should be thinking about what are the classic presentations. For autoimmune health, as I talked about, classically autoimmune arthritis is worse first thing in the morning and better with activity, while your typical degenerative arthritis or aging-related osteoarthritis is typically pains that are worse with activity and better with rest. There may be a little bit of crossover with symptoms. So for example, folks with wear and tear arthritis or degenerative arthritis can have some stiffness in the morning. It's just that it's not stiffness lasting for 4 to 8 hours like you see in rheumatoid arthritis. It's more stiffness for 10, 15 minutes and tends to work itself out after you get up. So the things you want to be looking for if you have pain and you're trying to tell, are my pains related to a rheumatoid arthritis, autoimmune kind of picture, or is it more aging, degenerative arthritis picture? Do you have classic symptoms of more wear and tear arthritis or more autoimmune arthritis? Again, pains that are worse either with rest and first thing in the morning in autoimmune conditions, or pains that are worse with activity. That's more wear and tear, degenerative arthritis. Then you want to get evaluated by your physician. Your physician will want to hear your history for sure and figure out those differences that we just talked about. They'll also want to do an examination to see if you have any evidence of inflammation in the joints. So inflammation in the joints will present as warm, swollen, tender joints. On the other hand, more wear and tear arthritis joints, there may be some swelling, but it's not going to be as inflamed. It's not going to be warm and red and hot looking like an inflamed joint could. And there may be a little bit of instability, just signs of chronic wear to the joint from chronic use or prior injuries, more of the wear and tear, kind of aging-related osteoarthritis. And then if there's suspicion that you have an autoimmune issue, they'll then want to do some labs, looking for inflammation, possibly some antibodies as well, looking for conditions like rheumatoid arthritis. And then imaging can be useful as well. My own practice, if someone has findings that are concerning to me for inflammatory or autoimmune arthritis, there's a good chance we'll end up doing an ultrasound to look for any signs of inflammation that are really classic for autoimmune inflammatory arthritis. On the other hand, if it's more wear and tear arthritis, it may be more X-rays or an MRI to look for more classic wear and tear arthritis changes. And then when it comes to treatment, the way that we typically treat autoimmune arthritis, including rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, is going to be with medications that are meant to control the immune system so that your body is not causing inflammation in the joints or damage in the joints. Those are typically immunosuppressants meant to keep the immune system in check. On the other hand, for degenerative arthritis, aging-related osteoarthritis, it's going to be more treatment of stability issues to begin with. Stability and instability in particular is what drives degenerative arthritis, meaning you have a loose ligament from a prior injury. It then leaves the joint slightly unstable, progressively over many years will eventually lead to osteoarthritis and damage in the joint. So first off, for degenerative arthritis, working on stability issues, and that primarily means working on strengthening exercises that can be with physical therapy. If that's not enough, then considering injection options, and I would generally recommend a regenerative medicine treatment option, things like prolotherapy, platelet-rich plasma, or bone marrow stem cells, to treat not only stability issues, but chronic pain issues as well. There is some crossover in terms of how we try to treat these two different groups of conditions, meaning when it comes to either autoimmune health or wear and tear, aging-related osteoarthritis, we do want you to maintain your strength through strengthening exercises. Just anything that helps to stabilize the joint is good, whether there's instability or chronic inflammation. We also want you to optimize your metabolic health. So we know that there is and by optimizing metabolic health, we mean eating a diet that tends to be lower in inflammation, that helps to optimize your weight and your blood sugar as well. So we know that not only can improving your metabolic health help out with inflammation in autoimmune conditions, but we know that as we get older, there's a connection between many of the problems that we have with aging and our metabolic health. And by that, I mean, when you look at things like not only osteoarthritis, but also neuropathy, diabetes, cardiovascular issues, they're all very linked to our metabolic health. And by that, I mean how well controlled is our blood pressure, our blood sugar, our weight, all of those things. As we get older, a lot of the things that we suffer from aging as we get older are connected with our metabolic health progressively getting worse over time. And so there's an opportunity to improve some of the things that ail us, not only from an aging standpoint, but from an inflammation standpoint, by working on some of those metabolic health conditions. I hope that's helpful about giving you a sense for how you can figure out whether your condition or pain is more likely related to inflammation like rheumatoid arthritis and autoimmune conditions, or more aging and degenerative related arthritis. If you found this helpful, please give us a like and subscribe to the channel. If you want to learn more about us, you can check us out on any of our social media sites, as well as our website, chicagoarthritis.com. Until we connect again, have a good day and live well.